Oh, hi there, everyone. Linda here from Just For Tummies. Welcome to today's live video. And today we're going to be talking about HRT. HRT, the menopause and female hormones. So I have an excellent guest joining us in a few minutes. Who is an expert in HRT and the menopause. Her name is Jane Pangbourne. Her website is Menopausal Not Mad, and she has a Facebook group called the HRT Truth Collective. And she's also on Instagram as the HRT Truth Collective. So please do connect with Jane on those platforms, because if you are interested in HRT, they are great resources. Now, some of you may find it strange that I'm inviting someone onto the Just For Tummies Facebook page to talk about HRT, which is a chemical, a drug, because I'm a natural health therapist, of course. But just let me say this before we get Jane on the live. So I've gone through my menopause. I'm well past it. I'm 62 next week, and I don't have any menopausal symptoms at all. Oh dear, where have you gone? Disappeared. Just a moment, let me get you back. Yes, I don't have any menopausal symptoms whatsoever. When I started going through the menopause several years ago, I had some hot flushes, I had some night sweats. I found that eliminating alcohol, especially wine, dramatically reduced those symptoms. Okay, I had some low mood sometimes, bit of sleep disturbance, little bit of indigestion, but nothing that had any impact on my quality of life and my ability to do my work. Back then, when I was going through the menopause, I was running a busy natural health clinic, and I was in the thick of developing Just For Tummies, the supplements. However, had I had more severe, debilitating menopausal symptoms, being a natural health therapist, I would have looked at my diet a bit more, my lifestyle. Could I have made any changes there? I would have sought the advice of the natural health community, a nutritional therapist, a medical herbalist. I may have had some acupuncture treatments, reflexology, aromatherapy. But of course, for some women, they may not want to go down the natural route. They may have tried all the natural things and nothing's worked for them. They may not be able to afford consultation fees for natural health therapists and complementary therapy treatments. And that's their choice. It's their choice what they want to put on their bodies and in their bodies. And that applies to HRT. And what's important, HRT is here, it's here to stay, and we can't brush it under the carpet. And I want to learn more about HRT, and I know that many women in my communities do too. And I want to know about the benefits, the safety, and any contraindications to HRT. So that is why I wanted to invite Jane to speak to us today. So without further ado, let's get Jane into the live. Hi there, Jane.
Hi, how are you doing, Linda?
Yes, I'm great, thanks. Are you?
I'm good, thank you. Yes, all good. Your lighting's much better than mine, so apologies.
No, it's not, Jane. It's not. I was going to say the same thing to you. I was going to ask you what lighting you use, because do you use any of those circular lights?
I have got one, but I can't use it because I'm a complete technophobe. I'll be honest with you, what I have, and I can't really turn my camera, but I have a little sort of bedside light over sort of on the side here, and on this side I have a little standing lamp, but it's sort of on the floor, and my overhead light. So I've just kind of cobbled together stuff from the house, to be honest.
Well, honestly, it's perfect. I mean, your light is very soft, very gentle, very relaxing. I've got several of these ring lights, and I don't like them. They're very bright, and I just can't seem to get them right.
No, and I find my ring light reflects off my glasses if it's at the wrong angle.
Mine does look.
Yeah, you can see. But only when you do that. But I just can't. I can't get it right. So yeah,
drives me nuts. Anyway, let's get on, because we've got loads to get through.
Yeah.
I know we spoke briefly yesterday, and I told you I had quite a list of questions from women. After my email went out last night at 5 o'clock, I've had a lot more questions come through as well. So I'm really, really pleased that we're doing this live, Jane, because so many questions, so many women very confused about HRT, scared about taking HRT. So let's get started. So first of all, if you can just tell us a little bit about yourself and why you became so interested in menopause, HRT.
Yeah. Okay, no problem. So first of all, I'm not a doctor. I'm not a medic. I am a senior member of the International Menopause Society and a healthcare professional with the British Menopause Society. My background is in personal development. So I worked very many years ago when I was much younger. I was in hospitality management and then ended up going into personal development and training and working with people with learning difficulties, and that transpired then that I was better working with the more mental and physical health side of support. So that ended up being working with women. It wasn't really planned. I'd like to say I'd planned it, Linda, but I'm a bit random. I didn't plan any of it really. It just sort of happened. And I worked in the world of body positivity for a number of years. That very quickly became the world of perimenopause. I had become perimenopausal, and obviously we'll talk in more detail about this, but I became perimenopausal about 38. Didn't know at 38 that I was perimenopausal. So probably in my early 40s was when
Can I just come in there? Is that quite young, 38, to be perimenopausal?
It's considered, technically, it's considered to be premature perimenopause, but I kid you not, there are so many women under the age of 40 who are perimenopausal, and that might be genetic. It might be a medical issue. They might have gone into surgical menopause, for example, which obviously is menopause, not perimenopause. But some women will say, my mum or my auntie was early perimenopause, so I was expecting it. Others are very surprised that they're in their 30s or early 40s. And many women are in their late 50s before they're perimenopausal. So it can be either end of the scale. And it's only retrospectively really that I look back and think, I was definitely perimenopausal about 38. But I didn't really do anything about it because I wasn't knowledgeable enough to do much about it till my early 40s. And that's when what I was doing from a work perspective, really, it sort of piqued my interest personally, but also professionally as well. And that's pretty much all I do now, is just research and talk about perimenopause and hormones and HRT.
I know you're immersed in it, aren't you? I know it's your passion. And I mean, obviously, one of your passions is to help women who are struggling with menopausal symptoms as well. Because some of these menopausal symptoms, like I say, I pretty much sail through, but some of them can be so debilitating, and some women can become suicidal, can't they?
Yeah, I've just, strangely enough, this morning I had an urgent consultation with a lady who's in my group. I squeezed her in because there wasn't any space, and she was having really intrusive thoughts and really struggling. And I said, okay, let's talk. And the poor woman is just struggling so much, purely and simply because her hormones have depleted. She is perimenopausal. She is actually on HRT, but it's not the right dose. So we can talk a little bit about that. And the doctor is rebelling against her being on a higher dose. So we've talked about her options. But yes, from an impact to life perspective, the most impactful and debilitating symptoms will be things like low mood, depression, high anxiety, and as you say, sometimes suicidal thoughts, which you might have seen in the papers a few months ago. And sadly, a lady did actually take her own life, and her husband was saying that it's purely down to
No, I didn't see that, actually.
It happens a lot.
And of course, weight gain as well. Weight gain, Jane. I mean, not wanting to be vague. I did put some weight on through the menopause, but And I know it's quite common weight gain through the menopause, but I also think, well, back then, I was working 6-7 days a week, 12, 14-hour days, ridiculous, crazy. I know that. I should know better, really.
Yeah.
So I didn't exercise. Maybe I wasn't eating as well as I should have done. I know all these things, and I plonked some weight on, but I do think the menopause had something to do with it.
Yeah, it is a concern. A lot of women say the same. We try not to focus on the weight element too much, but you're absolutely right. When we're low in estrogen, we can often find that our bodies portray more of an androgenic look, because of course we don't have enough of the female hormone. So you can end up with that weight around the middle, that belly that we all love to hate. And quite often what we'll find is that women who then have their hormones balanced find it easier then to manage their weight. It's not, HRT isn't the magic cure to losing weight, but it can help you to manage your weight more effectively, if that's the reason you're putting on the weight.
Okay. And you and I, we've known each other a few years now, haven't we? And I don't know how I came across you now, Jane. I can't remember.
I think it was me that came across you, actually. I think I found the Just For Tummies website, or Tummy Talk, and I wanted some probiotics, and then it just went from there. I think I looked you up to see what you were all about, and really liked everything you stood for, and it just went from there.
Yeah, and that was before you had your very successful the HRT Truth Collective Facebook group, wasn't it?
It was. In fact, the Truth Collective's only been going now for about 16 months. And I started it because I was involved with other menopause groups, and it was frustrating me that I wasn't able to focus on my passion, which was informing women and educating women about how to use HRT safely. So I decided to start a group just to see if a few women would like to join me, and I'll just give them the facts and educate them on what they can do. And then 16 months later, we have 15,000 members. So we're growing. So it's been great. And I'm really happy. I'm happy to help. And
well, congratulations on that, because I know you work really hard in that group.
Thank you.
I just want to say to people, to women watching, and maybe men watching, because menopause affects men as well.
Of course.
Indirectly. That ladies, if any of you want to post questions on this live, you're more than welcome to do so. But I do have quite a long list of questions to ask Jane. So if we don't get around to your posted question, then over the next few days, Jane and I certainly will. So don't worry that your question will not be answered. And I don't want to talk for any more than an hour, so if I'll cut off after an hour. And Jane, if we don't get through everything today, then is it okay if I invite you back and we carry on with the remaining?
Of course, I'm happy to chat HRT anytime, Linda.
Right. Okay. So when I sent my email out last night, I had several emails come back to me, replies from women. And a couple of them raised the question of HRT and breast cancer, in particular, estrogen receptive breast cancer. And this seems to be a real concern. And it's something that, as I say, I don't know. I know very little about HRT, but I know that that's been, I've heard that a few times. So can you just cover that for us, because I think that is very important, and something that crossed my mind. How does a woman know if she is if she has the propensity to develop estrogen receptive breast cancer when she goes on HRT? How would she know that?
So I always like to address the elephant in the room to start with. So I'm glad you've raised the breast cancer issue straight away. First of all, I would urge anybody that is concerned about this element of HRT to read the book Estrogen Matters by Dr. Avram Blooming. It's like the Bible for anybody that's interested in HRT, and it will answer a lot of the questions in much more detail than I can. This is what I'm going to say now, makes me quite unpopular, but I'm going to say it because it's important to say. So there are no studies that evidence that HRT causes breast cancer. Now, that will be surprising to people because that's what we've been taught, that breast cancer is caused by HRT in a lot of cases. Now, estrogen receptor breast cancer is slightly different, and I will touch on that. But just to clarify where that comes from, where that thought process comes from, we were using HRT relatively effectively up to in the sort of 60s, early 70s. I can't remember the exact dates, but it'd been introduced, and we were doing really well with it. Women were finding they were feeling a lot better. Doctors were happy to prescribe. Then sadly, what I was going to touch on this later, but as it's come up, sadly, we didn't know, the doctors didn't know at the time, that introducing estrogen on its own can bring a higher risk of uterine cancer. And I know you didn't ask about uterine cancer, but as it is kind of relevant, because introducing the estrogen on its own, as it's meant to, thickens the lining of the uterus, which is all good, all healthy. But if you don't balance that with progesterone, which thins the lining of the uterus, it can over thicken and therefore leave you more susceptible to uterine cancer. Okay. So very sadly, a lot of women did die of uterine cancer for this reason. So I will touch on this later, but we always have estrogen and progesterone if you still have your uterus. So that was early days. And then in 2002, the Women's Health Initiative, God bless them, put out a now evidence to be highly flawed study. Actually, I think the results were leaked before it was properly studied anyway, properly released, which essentially said, it's proven HRT causes breast cancer. They've since apologized for this study, for the way that it was portrayed, and they've accepted that the data was flawed, and it was a lot of the data was manipulated and not portrayed in the correct manner, and a lot of the women in the study were already at higher risk of breast cancer. For example, they were older, they'd been postmenopausal for a long time, they smoked, etc., or they were overweight. So it wasn't a fair study, and it wasn't based on facts. So from that moment, of course, it hit the press. HRT gives you breast cancer.
When was that, Jane?
2002.
Oh, okay.
Yeah, so 20 years ago. So from that moment, give or take a few days or weeks, HRT was stopped. Women got rid of their HRT, doctors wouldn't prescribe HRT, and it became an absolute no-no. We don't prescribe HRT. And from then, I wasn't involved at all at that point, but from that moment, we've been fighting the tide of HRT gives you breast cancer to try to prove that that's not the case. And actually, it isn't evidence to cause, HRT isn't evidence to cause breast cancer, but when you look at estrogen receptor breast cancer, and I do have a blog on my website, just touches on this slightly, which is very simply, I'm quite a simple person, quite simply called, Will HRT Give Me Breast Cancer? So there'll be a bit more detail on there. But with estrogen receptor breast cancer, you can't know whether you've got that unless you've been diagnosed with the BRCA gene, which obviously is a completely separate situation. But I will tell you that even many women who have had breast cancer, and some of those are estrogen receptor breast cancers, still take HRT. And yes, they're monitored by their gynecologist, by their cancer specialists. And yes, they are possibly on a lower dose than somebody else would be on. But for those women, the benefits in terms of symptoms management and the other long-term health benefits, the benefits of taking HRT far outweigh any small additional risk of them having that extra estrogen in their system. So, for example, I've got a few clients actually, and a few women in the group who have had breast cancer who are on HRT, and they're on perhaps half the dose that somebody else would be on, but it just manages their symptoms, and they're being monitored, and they're comfortable with that additional risk. So estrogen receptor breast cancer is slightly different in the sense, obviously, estrogen feeds that cancer.
Yes.
It automatically mean you can't have HRT. You talked earlier, Linda, about giving people choices and options. And I certainly feel it's my job to say, okay, here are your options. Here are the possible risks. Here are the absolute no risks, where that made up risks or risks that are no longer considered to be risks. Now you make your decision. Most women will say, actually, you will have to prize the HRT out of my dead hands because I will never give it up. Those women, but some say, okay, I'm just going to take it for a short while, see how I get on. If I feel loads of benefits, I'm going to carry on. If I don't, I'll stop. I'm certainly not here to bully anybody into taking it, but it's important that women know that breast cancer isn't a reason not to even consider it if that's what they choose to do.
If they've got all the information, they can then arrive at their own risk-benefit analysis, can't they?
Absolutely. And it's really important not to just, for women not to be told, and this often happens, not to be told your mother had breast cancer or your auntie had breast cancer or somebody else in your family had breast cancer, so you can't. Their risk is probably actually not that much higher in that situation. But to be blocked without being given any more information so they can make their own informed decision is really disappointing, because it doesn't allow women to make informed decisions. It doesn't allow them to make their own decision for their own needs. And I think I can say hand on heart, and I know breast cancer is a terrible disease, and I've been fortunate enough not to have that in my life, but I could say hand on heart that if I were unfortunate enough to have it, I would still try to take my HRT, because I can't function without it, if I'm honest. But that's my decision and not necessarily somebody else's.
Yes. Okay. Thank you for that.
Yeah.
Do you think there's a case for women before they actually start taking HRT that they have a blood test for the BRCA gene?
I don't think it's a standard. I don't think it's necessary unless it's in the family. If it was in my family, I certainly would recommend that.
Yes.
Yeah, but and I suppose that's to be recommended regardless of HRT, to be honest. Blood tests are relatively common anyway. General hormone blood tests prior to being 45 years of age, if we're checking for sort of hormone levels. To be honest, the blood tests don't really tell us much about the hormone levels, other than it can confirm whether you're postmenopausal or not. But as you'll know, Linda, your hormones fluctuate all the time. So just one blood test isn't going to tell me whether somebody is perimenopausal, because it's just a snapshot of what's going on with her hormones on that day at that time. If you took the blood test 4 hours later, it could be completely different. Mostly HRT is prescribed based on symptoms, but under the guidelines are that if you're under 45, it's worth having a couple of blood tests 6 weeks apart, just to kind of see if what's going on with them. And of course, it's not always menopause. Sometimes thyroids need checking, vitamin levels, etc. So there's, much as I talk about menopause all the time, I'm well aware that not everything is menopause related. So I'll sometimes say to women in the group, actually, you've just had a virus, you've just had COVID, for example. That's probably why you feel like you do. Let's get that sorted first, get better, and then you can reassess how you feel. So it's not always menopause.
Okay. On the subject of blood tests, one of the questions that came up actually from a lady is, when you're taking HRT, does a woman have to have periodic blood tests to check her hormone levels?
Not usually. If you're on HRT and you're managing well and your symptoms are managed and you're feeling good, there's no need to have ongoing blood tests unless something changes. A time when I would often ask a woman if she wants to ask for a blood test of her estradiol levels might be if she's on a reasonably decent dose of HRT and she's still not feeling great. Because what can often happen is that the absorption of the HRT isn't effective enough. Some women absorb better than others when they have transdermal gels or patches. And in fact, I had one client who she was on patches, and she just couldn't get them to absorb at all. And she finally, with lots of trial and error, managed to find a tiny little space on her back, in the middle of her back, that would absorb the patch. And she was good. It was all fine. But up to that point, her estradiol levels just weren't increasing, even though she was on pretty much the maximum regulated.
Isn't that odd? Isn't that odd that there was only one place on her body?
So strange. And that's quite unusual, to be fair. But often I will say, you know, if you've been on HRT, you're still not feeling great, everything else has been checked and you're all okay, then I would have your estradiol levels checked just to see if you're absorbing. In fact, I had a lady 2 days ago who said, she said she didn't feel too bad, but she'd had her bloods done, and she wondered if she was absorbing well enough. And generally, estradiol levels, normal levels that I would hope to see, would be about sort of 400, 450. And hers were 34. So I said, well, that's quite low. But she said, I don't feel too bad. And I said, well, you obviously don't need too much then. So from her perspective, we decided to go down, and we'll talk about types of HRT in a minute, but we decided to go down the tablet route because she would be able to absorb it more effectively that way, as opposed to the patch or gel route.
Okay.
So we just had to kind of tweak it a little bit for her, and she should be fine, but we'll see.
Okay, can we just go back a little bit? Can you just talk a little about menopause symptoms? The more common menopause symptoms, and maybe the less common menopause symptoms that women, I mean, most women know that, you know, it's fatigue, it's mood swings, it's weight gain. These are the common ones, aren't they? But the less common menopausal symptoms as well.
Yeah, just in terms of common as well, you're right, things like mood and hot flushes is common, but actually many women don't get hot flushes, which is confusing for many, because they expect to get hot flushes and therefore don't associate the other symptoms that they have with menopause, perimenopause, because they haven't got the hot flushes as well. But in terms of less common, I suppose things like burning mouth syndrome is less common. Body odor changes, slightly less common. Women will often say, however many times I wash, I still smell. I can smell it on myself, and I smell different to how I used to. Hair loss is hair loss is not as common as the other symptoms, but it's probably one of the most anxiety producing ones, because hair loss in women can obviously affect more than, it's not more just a physical thing, it affects self-esteem, etc. So hair loss is a big one, but overall I would say that most of the symptoms are as common as each other. You know, things like bladder leakage, itchy vagina, erratic periods, palpitations, low mood, as you say, anxiety, anger. Anger is a big one, where you have these lovely, quiet women with no previous anger issues who suddenly become these raving banshees. And I have to admit, I was probably one of those. I'm not an angry person. I'm talkative, but I'm not angry. And I do remember throwing a chair at my lovely husband and thinking at the time, that's not normal for me to be doing that. Why am I doing that? That's not how I normally behave. So although there are some quirky little symptoms, a lot of women get what you might call electric shock feelings, or feeling as if ants are crawling under your skin. They're perhaps less common, but everybody's a little bit different. And I would say that the mood and the digestion issues, plus the bladder leakages, tend to be the most upsetting for women.
Yes, and of course women contact me because they're suffering with bloating, irregular bowel movements, indigestion, acid reflux, and that's why they come to me, because they're going through the menopause and they need help with those symptoms. And I
send them back to you if they talk to me about it. So
yes, that's right. Okay, so thank you for that. So if you can just talk a little bit about the different types of HRT, including why would a woman take oral HRT, have patches, or creams.
Understood. Okay. It's a good opportunity to also, because I know there was another question about body identical HRT and about horses pee.
Yes.
So I'm going to incorporate all of that into the same
Great.
answer, if that's okay.
Yes.
So I know somebody was interested in knowing whether HRT is made from horses pee, horses urine. There is a brand, there is a product called Premarin, stands for pregnant mare's urine. It still exists and unfortunately is still prescribed. It's not body identical, obviously, and it comes in tablet form. And I know a lot of my clients and the people in my group from the States will be prescribed Premarin quite a lot. It's a lot more popular over there, but still available here. However, I don't recommend Premarin. It's certainly not one that is body identical and as safe as I would want for any women I speak to. Plus, it's not particularly nice for the pregnant mare. So that's from an animal perspective. But the types of HRT are there are lots of different types, but you've got patches, sprays, gel, and tablets. So the type of HRT that you might choose would probably relate initially more to how you want to manage your lifestyle. So, for example, if a woman was a busy mum of young children, I'm probably not going to suggest that she starts off with the gel, purely because it takes just a few minutes to dry, and then you're not supposed to have skin-to-skin contact for about an hour and a half, 2 hours. So if you've got young children crawling all over you, you haven't got time to wait.
It's not practical. No.
Exactly. So from a practical perspective, that's a consideration. But Premarin aside, the tablets are a good option for many women because, of course, they're easier. You just pop a tablet. There are estrogen-only tablets and combined tablets, which is a little more complex. We don't need to go into all the detail of that now. But the estrogen in the combined tablets and the estrogen-only tablets is body identical. So it's made from the yam plant, nice and natural in its base, and therefore nicely matched to what our normal hormones would be if they were produced.
That's the estrogen. That's the estrogen.
That's the estrogen. The progesterone in the tablets is synthetic.
Okay.
So it would be something like the contraceptive pill, for example, or the Mirena coil, that sort of synthetic. The tablets are good. The precursor to that, when I'm speaking to a woman about tablets, is that there is a slightly increased blood clot risk with tablets because, of course, it goes through your whole system. Your liver has to process it. So a little like the contraceptive pill, there is that slightly increased blood clot risk. It's not a high risk, but it's a risk that a woman might say, yeah, I'm not going to do that. I'm fine not having tablets. I'd rather choose a transdermal option, which is obviously through the skin.
Can I just come in there, Jane?
Yeah.
I'm sorry, because one of the questions I've received from a lady, she went to see her GP. She's going through the menopause. She asked about HRT, and her GP said, "No, I'm not recommending that because it will increase your risk of having a stroke."
Understood.
And I went back. I emailed her back, and I said, "Well, have you had a stroke previously? Have you ever had, a TIA, a transient ischemic attack? Have you got high blood pressure?" No. So what?
Yeah.
What evidence does the GP base that?
Yeah, the GPs aren't fully up on HRT. And if we were looking at the tablets, it does have this slightly increased blood clot risk. However, if the patient doesn't have regular migraines, isn't a smoker, isn't grossly overweight, and doesn't have high blood pressure, they're not in a high risk category. So if any of those apply, I would definitely say, don't go down the tablet route. You don't need that extra risk. That's fine. Let's not do that. But if none of those apply and the lady would like to take the tablet form, that's fine. There is that slightly increased risk, but it's small. It's quite common for a doctor to say, "Oh no, you can't have HRT because it'll cause strokes." That's not true. There is that increased risk with tablets. It's small, but then if we go across to patches and gels and sprays, there is no increased blood clot risk, no increased stroke risk, because it's gone through the skin, obviously being transdermal. Nothing has to be processed through our liver, and it's there is absolutely no evidence of any extra risk from a blood clot or stroke perspective. I tend to start with patches, gels and sprays anyway when I recommend, just because I don't particularly want somebody to have any additional risks. But if they choose to have the tablets, that's fine. It's not a massive, it's not a big problem. It's just that everybody needs to be informed, of course. So do you want me to talk about the gels and the patches, or is that too much detail at this stage?
I think as long as women know that, you know, they can take it orally, gels, patches, sprays.
Absolutely.
I think that's enough for now, Jane, because we've got so many more questions.
No, of course.
Yes, is there a time limit to taking HRT? Is there a time in a woman's life when she has to stop taking HRT?
Back to what I said earlier in terms of the risks. The risks are not the risks that people think they are. There are fewer benefits as women age. So a lot of doctors and clinicians will say you have to stop HRT when you reach 55. You have to stop HRT after 5 years. You have to stop HRT after 10 years. Or you can only have it for a year, or by the time you reach 60. All of those things are often said. There is no increased risk with the transdermal body identical HRT for older ladies. There is a slightly decreased benefit. So some of the long-term benefits, for example, of replacing our estrogen are increased protection against osteoporosis, increased protection against heart disease, against depression, dementia, diabetes. So the increased protection against heart disease, for example, lowers, of course, as we age, because we have an increased risk anyway. So, of course, HRT isn't magic. It's not the elixir of youth, sadly. So it's not going to solve all things, cure all diseases, and cure all cancers, which I think was a question that came up. It's more a matter of reducing the risks to a level that they would be reduced if you had your estrogen naturally and you were the age you are anyway. That would be your natural level of risk. What actually happens if you don't take HRT, it doesn't mean you're going to get osteoporosis, heart disease, and all those other horrible nasties, but you have that slightly increased risk because you don't have the estrogen in your system. So if you live a healthy life, and I'm an absolute advocate of eating well, exercising, although, as you know, Linda, I've done my back in, so not much exercises at the moment.
Is it feeling better today?
A little bit better, and I'm sitting here with a hot water bottle behind it, but it's fine, thank you. So I'm an absolute advocate of living a healthy life, not abusing alcohol, and all the things that we should be doing. But for me, it's important to balance that alongside introducing the estrogen that my body craves and needs. And in the old days, you know, 100 plus years ago, probably 150 plus years ago, we'd have been dead by the time we were in our mid-40s, early 40s anyway. So we didn't need our hormones. We didn't reach peri or post-menopause to any degree.
Yeah,
now we're privileged to live to our 80s. And actually, on that note about age, my oldest client at the moment is 86. And she started HRT last year. She came to me having had 20 odd years of feeling awful. Joined the group, I think, and decided she wanted to do something about it. She started HRT. She's on quite a low dose, as it happens. She didn't need much. And she said it's just like a whole new world to her. She feels like she's how she was 20 plus years ago, before she was.
Well, that's interesting, because I've had several emails from women. I'm 67, still blowing hot and cold. Is 71 too old?
No.
Is it safe to start taking HRT after the age of 68 for the first time?
It is fine to do that. It's absolutely fine. We need to have your blood pressure checked, but we do that with any woman. So your blood pressure needs to be checked. And if you do have high blood pressure, it needs to be managed before you start HRT. That's standard for all doctors to do that. But actually, as long as you're generally healthy, and if you're still struggling with symptoms, why wouldn't you replace your natural hormones with a yam-based product that has been tested and tested and tested and proven to improve the life of so many women? You'll have seen in my group, Linda, that the stories that some women relay are just heartbreaking. And I probably was one of those 10 years ago, but I didn't have anybody to talk to. So you just kind of get on with it, don't you?
Well, it's interesting what you say about the dementia, because I had an email from one lady last night, and there's a strong family history of Alzheimer's disease. Right. I can't remember, several close family members, actually, I think on both sides of the family. And she asked if she'd be able to go on HRT for those, for the cognitive benefits of HRT.
Yes, if she's postmenopausal or perimenopausal, absolutely. I'm assuming that she's not demonstrating any signs of Alzheimer's herself. No. But if it were me, I would be suggesting HRT as an extra belt and braces approach to protecting herself. We can't know whether she's going to suffer with Alzheimer's. My mum had Alzheimer's before she died. So for me, it was important that I did everything I could to make sure I was estrogened up and hormoned up and had everything in my backpack, so to speak, to protect me. I can't possibly know whether I'm going to fall into the same situation as my mum did, but I'll know that I've done everything I can to stop that. And of course, eating and all the usual, dietary elements.
Oh, yes, and there are certain supplements and herbs that can help.
Absolutely. I'm a big fan of the supplements and herbs when they're relevant. And I often, I would say every time I have, I write a report for a client, I'll always say, I'm not a fan of over supplementing, but there are some key supplements that you may benefit from. And sometimes those are your supplements, and Linda, and sometimes there are other supplements that apply to that particular lady. But it's important.
Well, we certainly know when it comes to, when the hormones start to drop and women start to get bloated, it can be because of, how it's affecting the gut bacteria. It's decimating the levels of gut bacteria. So very, very important to keep topping those levels up. And I was very interested to read recently about a research. I'm going a bit off tangent now, but I'll bring it back in a minute, Jane. Sorry. So I was very excited to read this research from the University of Michigan about a particular strain of friendly bacteria, Lactobacillus, that's in my For Women probiotic capsule.
I saw that update.
Did you see it?
Yeah, I saw it.
And I put Reuteri in there because it's been shown to help reduce urinary tract infections, throat bacterial vaginosis. But this research demonstrates that it may also help reduce bowel cancer. And I was really excited to read that. Okay, so that's great then. So there's no time limit on HRT.
No, you can take it for the whole of your life, the rest of your life, if you wish to. There's no pressure to do that. But like I say, I will not be giving it up ever. But I will say that, of course.
Let's have a look at some more questions then. Can I start HRT? I've never taken it, had no symptoms, but now reading so much about the benefits of estrogen, I feel I'm missing out and should take it. Well, I think you've covered all that previously.
Yes, I will add one thing though, Linda. There are a few women that come to me with no symptoms and with the same sort of question. And I would say, if that's the case and they're feeling generally well, usually, by the way, there are a few symptoms, but they've just got used to them and absorbed those symptoms as part of their everyday life when you dig a bit deeper. But what I would say is absolutely it's worthwhile taking it for the long-term health benefits. But in that case, I would say start on a really low dose and just see how you feel, because I certainly wouldn't want to put somebody on a higher dose if they weren't having symptoms, because they're obviously not in need of a really high dose anyway. So just start on a low dose and it gives you that added bit of protection.
Okay. Oh, and I think you've covered this one as well, Jane. How do I know when the right time is to start taking HRT? Can it be prescribed during the perimenopause? You've covered that. Yes, it can.
Definitely perimenopause. Yeah, as soon as you start experiencing symptoms.
Yes. And another lady, my worst symptoms are an increase in anxiety and sleeplessness, which are probably linked. This lady takes ashwagandha, which is a kind of Ayurvedic herb, and she says it really helps with the anxiety, but the insomnia is a killer.
If she's definitely perimenopausal and she's struggling with symptoms like that, probably she's struggling with other symptoms as well.
She's perimenopausal, yeah.
Yeah. Then HRT introduced at a low dose will definitely help. I also recommend magnesium, which I'm sure you would too. But I tend to say if you're going to go down the HRT route, absolutely introduce it, in her case, at a low dose, depending on her symptoms and depending on what she wants to do in terms of the format of it. And then perhaps introduce the magnesium as well and just see how she goes. I would think once she tops up her estrogen, that will really, really help, because it really disrupts the low estrogen can really, really disrupt sleep. And I have a friend actually who's not on HRT, and she's younger than me, but she'll often say, oh, I never get any sleep. And I'll just say, oh my God, you're perimenopausal. Will you just take some HRT? And she says, oh yes, but I'm fine on 2 or 3 hours a night. It's really,
what?
Really? No.
Like Margaret Thatcher, 4 hours a night.
No, exactly. Yeah, no, not that.
Right. So another question then. How long does it take to feel a difference once you start HRT?
Obviously, it's an individual thing. Some women can feel a difference really quickly. I was quite lucky. I was probably only a few days, but then there were lots of changes and tweaks that needed to be made along the way. So you might get an initial burst of feeling a lot better, and then it can kind of dip off again, and you need to make some adjustments. So even if you feel great to start with, it might need some changes. Most women take a few months, 2 to 3 months, just to settle into it. And I'll always say, be prepared for a little bit of disruption, because particularly if you're further down the road in terms of having been perimenopausal for a long time or already postmenopausal, because you've been deficient in your estrogen for a long time. So your body, as soon as you introduce it, your body's going to go, oh, great, not seeing this for a while. Thank you very much. So it will possibly make you feel a bit PMS-y, and you might feel a little bit nauseous, a bit like morning sickness. But most women are fine. But you might experience things like that, or sore breasts, or just feeling a bit weird for a few days. But that just settles once your body remembers what it's supposed to do with it.
Okay, great. I just want to say, welcome to everyone that's watching, and I hope they're finding this live of benefit. And ladies, those of you who have posted questions on the live, Jane or I will get back to you over the next few days. But I want to get through this list first. Yeah. So, Jane, what does a woman do if she's getting menopausal symptoms and she wants to go and see her GP and discuss HRT, but she's got a less than sympathetic GP? What does she do? Who won't put her on HRT?
Well, that's welcome to my world. That's pretty much everybody I see says that.
Is it?
Well, it's a high percentage, and it is changing. The world is changing, and doctors are becoming more informed about menopause and HRT. But we've got a long way to go, and I'm really sympathetic to doctors. They have a tough job, particularly since the pandemic. So I'm not critical of them at all. But we now need to really get a grip on offering them the training, which I know there is training out there for them, offering them the training, giving them the time to learn what they need to learn. It's not as if they need to take a whole new degree. You know, it's just a small section of their work. But many women will say, my doctor says he doesn't believe in HRT, he or she doesn't believe in HRT, won't prescribe it, says it's going to give me breast cancer, won't give me an increase because they said I'm on a high enough dose. So there are loads of blockers. What I tend to do in the group, of course, for free, I'll give as much advice as I can, along with my fabulous moderators who help me out. But if I see somebody one-to-one, I'll always do a full report afterwards. And if it's not the full report, sorry, if it's a shorter appointment, it will just be an email summary. Usually what will happen is we've covered all the individual areas that apply to that woman and what she needs and why she needs it and how that will benefit her. Quite often the woman will just take my report or take the knowledge that she's gained and just talk to her GP about it from that point. So it's back to what we said at the very beginning, actually, Linda. It's about educating the woman to be able to speak confidently to the GP. So when the GP says, well, no, actually, I can't give you HRT because the woman can say, well, actually, can I just have a conversation with you about that? Because I've looked into this and I've researched. And they may never have even spoken to me. They may have just been on a website, on my website, or on the NHS website, or the British Menopause Society website to find out more information. But the summary of that is, I think the first port of call is to become as informed as possible. Yeah, so that they feel empowered. If that's
not just with the menopause and HRT,
with
any health issue that they're going to see a GP about. You know, do your research.
And it's about just taking, without sounding too harsh, and I apply this to myself as well, it's about taking responsibility for our own health and saying, actually, you know, it is my body and I really need to look into what I want to do with it. That might be HRT, it might be something completely different, and that's fine. But the GP is there to work with you. And so if you arrive at the GP fully informed, it really is saving him or her some time as well, by cutting to the chase, saying, I've done all this research, this is what I want, and this is why, please. Most GPs are really accepting of that. Some not so much, but most say, great, fine, thanks for doing the research, I'm really happy to give that a go, even if just on a trial basis to see how that works. But other than that, I tend to refer women to the guidelines, the NICE guidelines. I refer them to menopause specialists, a GP that I work with.
Yes. I was going to ask you about, you do work alongside a GP who is a menopause specialist?
Yeah, I work alongside Dr. Unsworth, and she is she's a fantastic menopause specialist, also a member of the British Menopause Society. She's really busy, of course, because I keep sending people to her, but there's never any pressure to book a private appointment with her, and I'm certainly not paid to recommend her, but she will look at any report that I've put together, which saves her some time. She'll just assess what I've said, then she'll ask the more clinical questions that she needs to ask to make sure she's happy prescribing, and then she can prescribe as well. So it doesn't have to be her. There are plenty of fabulous menopause specialists out there, but they're really difficult to get to see, as far as I can gather. So I often say to women, if your GP is really not happy to prescribe, if you can afford to, go to see a menopause specialist GP first, get one prescription of HRT, then your GP will probably feel much more comfortable carrying on that prescription, because that onus of initial prescribing, whilst the GP is a little uncomfortable with it, has been moved over to the menopause specialist. So it just makes the transition a bit simpler, just makes it calmer for everybody. But I appreciate not everybody wants to go private. So.
Okay, that's great. Well, I'm going to kind of wind things up now, Jane, if you don't mind. I know there's probably a lot more that you could say.
There's loads.
I thought there were, so we're going to have to do this again.
Shall I just stay here while you go? Shall I just stay here and just keep talking?
We'll rearrange another one. So
yeah.
I want to thank everyone for watching, and I hope, ladies, those of you who are going through the perimenopause, menopause, postmenopause, have found it useful. Please do join Jane's Facebook group, the HRT Truth Collective. Connect with her on there. And Jane, I'd like to thank you for coming on here and giving up your precious time.
You're welcome.
As I said earlier, the questions that the women have asked on the live, you and I will answer those over the next day or two. Yep. And yeah, it's been absolutely fascinating, and I've learned so much as well, Jane. It is a fascinating subject, but anything that, you know, touches women's lives I find fascinating. And for me, it's all about supporting women through all the stages of their lives. So I wanted to know more about HRT, its benefits, you know, the safety, and any contraindications, as all women need to know. Yes.
Absolutely.
So thank you so much then, Jane, and enjoy the rest of your day.
Thank you. You too.
I hope your back gets better soon as well.
Oh, thanks. I'll be fine.
All right then. Bye-bye now. Thank you. Bye, everyone, and thank you very much for watching. Bye-bye.